Good morning. Happy Monday. I hope everyone had a great weekend. Bob Ravenscroft, Vice President for Advancement here at Bryan Health. I have with me today John Woodrich, the Chief Executive Officer of Bryan Medical Center. Tomorrow we're going to have Dr. Matt Johnson from Bryan Heart here. And then either Wednesday or Thursday we're going to have Rich Lloyd, the President of Bryan College of Health Sciences. Real quickly, one quick announcement. Over the weekend, some of the calls into our nurse hotline were asking about could they come to the ED, and these were non-COVID patients. So through all of our heightened awareness from that, there's some confusion in the community about people who need emergency care, thinking that they can't maybe come to an emergency department at any of the hospitals in our community right now. That is not true. If you need to come to an emergency department for non-COVID things, please know that you can still come to the emergency department. Quickly, the numbers. Daily census right now is 339. Our Bryan Easy Visit screening option remains incredibly important. We have 8,901 that have accessed the questionnaire now, resulting in 2,509 easy visits, and 1,157 have used the COVID promo code. What's really important about that is by far the biggest supplier of tests in our community. The vast majority of the tests that have come through Bryan, or Lincoln in general, have come through the drive-through clinic, and the Easy Visit questionnaire is the best way to do that. It still takes a manual intervention, and I think the reason it's working is the physicians will read that Easy Visit, and then somebody is following up with those patients to say, yeah, you absolutely need to go get tested. So our drive-through clinic and the Bryan Easy Visit thing they're really connected, and they are working for the community. Some additional stats. We have now tested 1,377, and 944 of those have come through the drive-through. In total at Bryan, we are at 63 positive, 1,286 negative, and a big number that John's going to talk about, we only have 28 pending tests. So great progress there. Through our first pay period of the wage stabilization, there's another pay period, so in a total 4 weeks. And we haven't had any substantial discussion at this point going beyond that. Obviously, we're doing what everybody's doing, is analyzing the surge, available PPE, continuing to redeploy staff to other areas. The question about where are they being redeployed, temperature screenings, procurement of PPE has been one. Standing up a respiratory clinic was staff that was redeployed. Standing up a drive-through clinic was staff that had been redeployed. Opening up the additional units has redeployed staff. And then additionally, what it's given us a chance to do, there's always these projects that you want to take a look at and you don't really have time to do it. So we've been able to employ some teams of redeployed staff to take a look at some of those projects that, geez, you always wish you had time to look at, and we are doing that right now. I would assume priority testing is a factor. Iowa, especially once you get east of Des Moines, is much more population dense than we are in Nebraska, and I don't know if they're talking about healthcare workers, if they are hospital employees, in nursing homes, federally qualified health clinics, just don't know. What I can share is if PPE was available and properly used, it should be effective. So I don't think it's a PPE issue. Who knows what is going on over there, but we'll watch that.
If you think about last Monday when we presented to you, we talked about how many positives we had. And this Monday, we only come with the number going up by 9. I think that's a good sign of the social distancing, and what people are doing are being very respectful and stopping the spread of this. I think another key number in here is we were having as many as 300 pending tests about a week and a half ago. Today, we only have 28 that are pending. So through working with our third-party laboratories, we've been able to get the turnaround much quicker than it had been before. So those are really good results. Did want to share with you, we still have 4 positive COVID patients in-house, all 4 from Lancaster County. We have 8 in-house that are pending results. 3 of those are from Lancaster County and 5 are from outside of our county. So that is a total of 12 either pending or positive. Only one of those individuals is on a ventilator, and that is a new individual on a vent. If you remember last week, we reported we had 2. Both of those people have been taken off of the vents, which is good news. We have 6 of those patients in our ICU, 1 in our progressive care unit, and 5 in our general care unit. We also wanted to share with you, since we've been able to have our lab keep up with the testing, we are going to expand our hours at the drive-thru from 1:30 in the afternoon until 4. And whereas we were taking 60 patients a day, we're going to go up to 110 patients a day. So that'll give more people access, but once again, remember you need a physician's order, so please utilize Easy Visit or go to your primary care physician or talk to them and be screened first. The other thing that I wanted to talk about is still shortages of PPE. The 2 items we still need are gowns and basically disinfectant wipes. Those are the 2 items that we're most critical in. The others, we are keeping up with the supply and planning on the surge that we know will be occurring here in the next few weeks based on the models and the predictions that have been put forward. But good news, number of them being turned around, so very few pendings being out there, and then expanding our hours so we can see more people. With that, we'll take some some questions via chat.
The drive-through is really working well, and very few of our drive-through patients are coming directly from a physician visit or an order. The vast majority are coming through people who have used Bryan Easy Visit. So anybody watching, that remains a very effective way if you're not feeling well to determine if you need a test, and it will expedite that physician order.
So the average turnaround has been down to actually about 2 days now. We're still telling people 2 to 4, but in working with our third-party lab, they've been sending our tests to a different location, and they've been able to handle the increased volume for us. I would say at this point in time, from all the modeling that we've done, we believe that we're going to see our highest peaks in about 2 weeks. So to re-enter right now and do elective surgeries, we don't think is the right thing to do. We will continue to monitor, again, our PPE usage, but also if an individual has an elective surgery and it becomes more acute that they need to have that surgery done, we will do those, and that's what we're doing. We're taking that on a case-by-case basis. But I think for now, we don't want to have additional people come into the facility as well as utilization of that personal protective equipment. Great question, because I think you recall that we said some people that had tested positive, that then when we retest them. So in regards to individuals, that's around 58 individuals. And still, to my knowledge of this date, we've only had 1 positive as an employee.
Very well. It's working as planned. I saw an email over the weekend on just, reaffirming the procedures with everyone, but we have the germ robot, Frosty, and his companions have been doing an effective job.